As part of a team, this program at CEP is a really unique partnership with Emory and Georgia Tech. So one of the things that is one of the hallmarks of this program is being able to study and share information about what works best. So I'm excited, Emily, if you don't mind kind of sharing with us a little bit how you got into this work, and what some of your research study findings were.
Absolutely. I'm excited. Thank you for such a wonderful introduction, Megan. So for those of you who don't know me, my name is Dr. Emily Giannotto. I, as Megan said, am a new postdoctoral research fellow here at CEP. I got my master's and PhD from Georgia Tech in cognitive aging and adult development and aging. So I'm really passionate about, as Megan said, really everyday aspects of living, but most specifically about everyday memory, different forms of cognition, sleep, and things like well-being. And all of that is encompassed in what I will present to you all today. So without further ado, I'll talk to you about this latest study that I ran, and I'm excited to present. So for the purpose of today, I'm calling the talk Mutuality and Aspects of Everyday Living Among CEP Members and Care Partners. So what I will discuss today, I'm going to talk about mutuality. What is it? It's one of the terms that Megan started introducing to you already, but we'll dive in a bit more. I'll provide some background on the motivation for the study, on some good little pieces of information to better understand the context of why I was interested in this kind of amalgam of pieces of what makes up our members and care partners' everyday lives. So that's getting into aspects of everyday living and cognition. I'll talk then about the actual study that I ran, the scope and an overview at a relatively high level, and then really dig into the findings and implications and future directions. So for some background, this we know, right? Spouses' lives are completely and inextricably linked. People's lives are interconnected. You experience linked emotions and moods. This we know. Couples also have unique ties to one another and impact each other's daily lived experiences. So that ranges from emotions or affect and mood to mental health outcomes to actual physiological reactions, as well as stress, right? So you've got kind of everything in between, but we know that people's lives are tied together. And that's via things like shared experiences, shared emotions, shared or split responsibilities, shared environment or environments, and more, right? And so in that, and in the context of your lives being inextricably linked together and interconnected, mutuality, which we'll dig into next, and relationship dynamics, so how well those things work together, are important, but they also change throughout the day. And last but not least, just to kind of set the background, we know that individuals diagnosed with MCI and their spouses both face daily life changes, right? Not only for the person diagnosed with MCI, but for their spouse, their family members as well. Next, we know that sleep issues increase with increasing age, as well as with MCI. So this impacts daily cognition, affect, and more. This has been shown through prior research within persons and within spouses. We also know that self-reported sleep quality and sleep duration changes are associated with day-to-day cognition and low mood across a range of tasks. So we know that sleep quality impacts how you think on the day-to-day, and how you feel on the day-to-day. And that's across a number of different tasks. However, I've got some good news. Middle-aged and older adults seem to be actually less sensitive to poor night to next day sleep compared to younger adults. So older adults tend to be actually a little bit more resilient when we're talking about one night leading into the next day and how you think and act. So there actually may be more pronounced differences in cognition in everyday life, and that was part of the motivation for this study. Most of the time, these studies are done with lab tasks. So I wanted to know, in the context of everyday life, is that true, and what do these relationships look like? And then we also know that individuals with MCI generally tend to experience greater sleep disturbance. And because we know that spouses tend to share a bed, it's likely the sleep of a person with MCI will also impact the functioning of their care partner or the person that they share a bed with. We also know that among caregivers, sleep disturbance is also highly prevalent and often accompanies caregiver burden, lower mood, and occasionally things like impaired physical health as well. So it's not uncommon for caregivers to report struggling with energy or tiredness throughout the day, while simultaneously experiencing sleep disturbances, as well as things like trouble falling asleep. Again, often associated with partner or with people who share a bed. So on that note, we also know, and research has shown that on days when negative spousal interactions have occurred, caregivers report more negative affects, so lower mood. And so the idea is, how are these things linked within and between spouses? So here we're back to mutuality. And so this is kind of the impetus that will lead us through the rest of the talk. So what is mutuality? I like to think of mutuality as a measure of relationship dynamics. So mutuality, just like the picture shows, is really a nice collection of things that encompass what happens in a relationship. It's something we all experience, especially with someone like a significant other, but friends experience mutuality, family members experience mutuality. So this can be expressed love, how well or how you communicate, problem solving, aspects of reciprocity. So how much you're able to share with one another, like shared values, and lots more. But it can be a double-edged sword, so that we know mutuality can be really great and really high. And our members and care partners who participated in this study actually had really good mutuality across days, which is really exciting. So we know that people have pretty strong relationships in general. But when mutuality is lower, that can also have an impact on your day. And so the idea is, if mutuality is lower or higher, how does that impact from one spouse to the other? And on that note, right, in terms of a double-edged sword, we've got, going from far left to right, kind of the expanse of what mutuality might encompass. It can be the good, right, shared experiences and joyful moments like dancing. It can be impacted positively or negatively. So we go from things like dancing to the next couple of photos, which go, one person is sleeping happily, the other is wide awake, but doesn't necessarily look unhappy. So maybe there's some disconnect to perhaps mutuality being lower, right? If something is off. So emotional connectedness among spouses, this idea of mutuality really ranges and encompasses lots of different things. So when we talk about mutuality, to really put it into perspective, these are some questions on the mutuality scale, which was developed by Archbold and colleagues in the 1990s. But these are some really excellent and great questions. So when I talk about mutuality and relationship dynamics, this is really what I'm talking about. So we asked members and care partners about their mutuality each day for 2 weeks. So we asked them, these are just a couple of questions, but for example, how much do the two of you see eye to eye? And you might be thinking, how much do my partner and I see eye to eye? And that's the point, right? How often do you feel physically close to him or her? How often do you enjoy sharing past experiences with him or her? How often does he or she express feelings of appreciation for you and the things that you do? How often does he or she help you? How often do the two of you laugh together? And I love that last question. But the idea is that when we talk about mutuality, it encompasses so many things. There's communication, there's expressed love, there are shared experiences. And then there is the aspects of reciprocity, right? Laughing together is kind of a reciprocal activity. Helping each other is a reciprocal activity. And then last but not least, before we dive into my study, I want to talk to you about what I mean by dyads, because you will hear this word referenced throughout the rest of the talk. So when I'm talking about dyads, I'm talking about two, as you might have guessed. But one dyad is comprised of a CEP member as well as their care partner. So together they make up one dyad. And here specifically for this study, dyads were spouses or long-term romantic partners, so considered a significant other. And I did that on purpose, and we'll get into it. So I'm about to talk to you about the actual research we did. So my research question after all of this background was I was really interested in how patterns of daily living and cognition change for individuals and spouses impacted by MCI across days and from one day to the next. So the goal of this research was to investigate the daily interconnectedness of all of these kind of holistic approach aspects that make up a person's day and daily well-being and cognition. So we did this by measuring daily memory, daily mood, relationship dynamics, mutuality, collaboration, stress, caregiving, sleep, and more. But I'll keep the talk within this scope. So my hypotheses for this study were really around mirrored effects from one spouse to the other, and vice versa, right? Really looking at mutuality and this emotional connectedness piece. So really in terms of sleep, stress, mood, and mutuality, the idea is that these relationships would be mirrored from one spouse to the other within days and across days. So the idea is that, for example, if one spouse has poor sleep, does the other? And I would expect yes. If one spouse has better sleep, we may or may not expect that in the other spouse. But specifically when we're talking about mutuality, thinking about things like stress. Is my stress maybe even contagious to my partners? And you might be having these thoughts as you're listening to this talk as well. If I have a low mood or if I'm in a bad mood, is that contagious to my partner? And so these were the things that I was interested in looking at. So for this study, we had a whopping 54 members and care partners participate. So that's 27 total dyads. So 27 members and 27 care partners. And again, everyone who participated was considered in a dyad of a spouse or significant other member and care partner situation. What I think is really amazing about this study is that the average relationship length was 41 years on average. So we are talking about people who have been together for longer than I've been alive. And I think that's really amazing. So when we dig into mutuality and aspects of shared emotions and moods and stress, the idea is that we're getting at these really ingrained, really long-term relationships. Everyone was generally self-rated as healthy and highly educated. And then I've got a couple of other little statistics up here if you are interested. Members for this study were primarily male identifying, and care partners were predominantly female. In terms of the measures and design for this study, so on the right, this is actually part of the nightly diary form that was used. But so all of the participants in my study, members and care partners, completed 14 daily diaries each night. So each night for 2 weeks, they were emailed an individual email link. And from there, they filled it out on either a computer or a smartphone each day. So the diary, as you can see on the right, it's relatively easy to fill out. A lot of the questions were things like yes, no, or easy options. And then we had lots of sliders. So you could do a rating between 0 and 100. So we've got some example questions here about sleep. How would you rate the quality of your sleep last night from poor to very good? Did you toss and turn? Did you wake up in the middle of the night last night? And these are the types of questions that we ask about sleep, mood, mutuality, cognition, stress, caregiving, and more. Amazingly, we had about a 90% completion rate. So almost everyone completed almost all of their diaries. So we got really rich and really wonderful data. So getting into the brass tacks, what were some of the findings? First and foremost, we found that mutuality matters. So mutuality actually offsets poor sleep quality. It offsets daily stress, and it interacted with low mood, such that if one spouse was experiencing lower mood that day, but mutuality was high, the other spouse did not report lower mood. So it's actually a really encouraging finding. And I think the predominant idea here is that mutuality is this kind of great moderator. So when mutuality is high, people had better daily outcomes in terms of daily cognition, mood, and stress outcomes. So the idea is that mutuality, or high mutuality rather, is not only observed among our members and care partners in these spousal dyads, but it's something that helps buffer and offset potentially other aspects of your day-to-day living that might be problematic or less advantageous, right? I think the goal is to live well and have good well-being and good cognitive functioning throughout the day. And then the second major finding that I'll talk about today is that we found that sleep debt occurs and that it matters. So what that means is that over multiple nights of poor sleep quality, we found effects on mood and stress, but not on mutuality. So again, it's kind of another perk in terms of having good mutuality. So what that means is when we looked at 2 nights prior to any given day, right? So today is Tuesday. Instead of looking at Monday night, if we looked at Sunday night sleep, sleep debt mattered more long-term than just the prior night, which I think is a really cool and really interesting finding. If you think about it, earlier I talked to you and made a note that older adults tend to be less sensitive to night variations in sleep. And that's true here as well. So what's interesting was it wasn't just that night, it was 2 nights prior. And it actually was true no matter if the prior night's sleep quality was really high or if it was really low. So here, I think the idea is really looking at longer term effects of what I'm calling a sleep debt or a sleep deficit. And that the sleep debt was actually exacerbated by stress, and it mattered more than the prior night's sleep quality. So why does this matter? I think in general, what this study did was really elucidate and elaborate on the idea of taking a really holistic everyday living perspective. When we talk about MCI, it's not, especially in the context of the CEP, it's not a single person issue, right? This is something that we look at. We involve care partners, we involve family members and community members. And so I think the idea is that more holistic perspectives and approaches are important as we move forward in better understanding this space for spouses as well as individuals who are diagnosed with MCI. And so our kind of next big steps are looking at interventions specifically designed to enhance aspects of everyday living for caring dyads facing MCI. So we've done things like identified targets. And what do I mean by targets? So for an intervention, we're really, really excited. And this is the next step in our research process. about identifying and looking at ways to better improve sleep. So calling that sleep hygiene, but not just among members, also among care partners, right? So looking at how we can improve sleep quality, sleep quantity, the sleep environment. The next identified target, unsurprisingly, is mutuality. So when I talked to you about mutuality, we talked about things like communication, expressed love, working together to accomplish a shared goal, finding common ground. So the next step is really identifying, are there ways to isolate and improve or identify specific subsets of mutuality to do that with? So for example, would working on communication methods or strategies help bolster mutuality for individuals? And then would that be related to better daily outcomes? Would something like problem solving together be a good target? So that's one of the next steps too, is identifying specific subsets or facets of mutuality. And then another identified target is really thinking about the management of moody or low mood or high stress days. So are there stress management techniques? Are there low mood buffers? Are there physical activities or activities in general that can be done that help bolster managing lower days? And so these are all avenues that we're exploring here at CEP moving forward next for intervention. So kind of to sum it all up, at present, there's relatively limited comprehensive work on MCI caregiver and care recipient daily experiences, and in particular on longitudinal outcomes, specifically on daily cognition and daily well-being. Memory, sleep, stress, mood, and spousal interactions are all interrelated. We know that. Anyone who's in a long-term relationship knows that. And so the point is how can we demonstrate this and how can we better explore this through meaningful research? And here specifically with our couples impacted by MCI, because it's a lot easier to measure that with people who live in a shared space and also who share the same bed, so that we can look at sleep impact from one person to the other at the same time. Whoops. And then lastly, we know that spousal caregiving couples have unique ties to one another and that they impact each other's daily lived experiences, right? So again, getting into the idea of emotional connectedness and how there may or may not be kind of emotional spillover or crossover from one person to the other. Importantly too, I want to make a note that we know that with healthy aging, everyone experiences normal changes in cognition. But the idea here is that care partners for this sample are pretty well off and are able to maintain kind of regular daily tasks and goals. So the idea is that we're targeting and looking at both members of these dyads as individuals. And we're excited about the next steps. So in terms of some additional takeaways, I think at the highest level, what's important to note walking away is that sleep debt is a potential vulnerability for both members and care partners. So the idea is that we know sleep is important. How do we target that? How do we improve that? And we get that question all the time here at the CEP. What can I do to sleep better? So we've got a couple of really exciting sleep studies that are going on right now. We are trying, we are learning. We've got lots of strategies. I know in COG we go over it in one of our COG classes. And then we talk about it in terms of daily well-being too. So I think it's important to figure out what works for you and try to figure out what and how you can make or improve your sleep. And then last but not least, mutuality is an important moderator that impacts couples' daily lived experiences, mood, and stress. And most importantly, that it interplays with sleep. So whereas sleep debt occurs and happens, mutuality is kind of this key piece here where poor sleep did not impact mutuality, but mutuality improves individuals' daily outcomes, even when they experience poor sleep or sleep debt from even 2 nights prior. So members and care partners, if you're on here, mutuality is working in your favor. In terms of some big future directions, I think I've identified a lot of questions, a lot of targets from this research, and we're really excited. But the kind of bigger future directions are looking at expanding and replicating this work, right? So beyond just creating interventions, which we're really excited about, we also want to replicate and expand and improve at all times. So the idea is that I want to look at additional outcomes and associations among these variables, not just at the level of day, but from one day to the next. So we can identify things like, what is sleep debt? Is there a ceiling on sleep debt? Is there kind of a prime time course of sleep debt, right? So does it compound and over how long? So that's part of the next step. And then also identifying some alternative time courses of data collection. So for this study, it was a 2-week-long study. And I'm grateful to each and every one of the members and care partners who participated. I think one of the next steps is something I'm excited about, but potentially doing this in what are called burst measurements. So could we do this for a week, for 2 weeks, 3 or 4 times throughout the year? And really see, are these patterns true throughout kind of all of the seasons of the year? Does that change at all? Doing burst measurements, perhaps integrated with something like an intervention. So if we do this 2 times spread out over 2 quarters of the year, and then we do an intervention, does that data look the same, or do the patterns of day to day and day to next day, mutuality, mood, cognition, sleep, do those patterns change if we do something to change behaviors or daily functioning? So there's a lot of really exciting new things coming down the pipeline. And then I think when we talk about the context of CEP, a lot of the time the focus is on members. My study used data from members and care partners, and I think it's a really exciting step forward for us in looking specifically at our care partners, but figuring out how to prepare and potentially protect our care partners in terms of their daily well-being, their daily cognition, and then their long-term outcomes as well. We're grateful for you, and you're not forgotten here. And this study and this line of research also really takes into consideration the well-being of our care partners. And so moving forward, we're excited to not only continue this type of research and this line of research, but also to expand it to include more members and care partners in the future, and also a more diverse sample. We've also received lots of wonderful feedback from the participants in this study, but I think the idea would be to do something like make the diary even a little bit shorter, so that we could do things like ask you diary questions a couple of times throughout the day if it only took 2 minutes or so. And then we can look at things like, did something happen during the course of your day that impacts the rest of your day? So we can kind of look at this idea of throughout the day. And then I'm really excited about the future. I wanted to thank the Cognitive Empowerment Program. The study was made possible thanks to an Innovation Accelerator seed grant. Again, I'm super grateful to the members and care partners who all participated in this research. You all were so lovely to work with. And I really and truly appreciate you opening up about your daily lived experiences to me and to my study team. it's not forgotten, it's not lost. And we're really excited to continue sharing out these research findings with the rest of the research community, with the rest of our CEP members and care partners, and more generally with the research community, so that we can impact any and all individuals who are diagnosed with MCI, as well as their care partners. I think education and educational information on this topic is so important, and so important to widely disseminate and make easy to understand. So those are huge goals for us, and we're really excited moving forward. So thank you again. And then last but not least, I also want to thank my daily memory, sleep, and stress study team. So that's myself, Dr. Chris Herzog, Dr. Amy Rodriguez, and then my two research assistants, Alicia Naran and Elena Cabrera. So if anyone has questions, I left lots of time for questions. I'm happy to answer any and all.
Thanks, Emily. I think one of the things that really highlights for me is like this correlation between stress and sleep, and how it really does affect dynamics of the relationship and in the home, and that ability to have your cognition be functioning higher, as high as possible, right? And that's what we want, is like for you to be able to be in your homes as long as possible, functioning at as high of a level as possible. And so prioritizing some of the things that Emily has talked about can be one of those easy ways to highlight small improvements every single day. And so we got some feedback in the chat. We're talking about like cognitive stretching in some ways, things that are going to keep your brain healthy and your relationships healthy. One of the people in the chat said, can you talk about the impacts that grandchildren can make in daily experiences? My grandmother was widowed, but her family members filled in for that space. So we know it's not always going to be someone who you're married to or a partner that is stepping into some of these roles. Can you talk a little bit maybe about the role of grandchildren or adult children in some of this?
Absolutely. That's a wonderful question. So I think one of the limitations of my study is that I specifically looked at spousal dyads, right? So members and care partners who were spouses or long-term romantic partners. The diary did ask questions about other daily experiences, and people actually often wrote in the short answer sections about doing things with grandchildren or doing things with other family members. And so when you get down to the brass tacks of what makes up someone's day, as individuals get older, something that a lot of individuals look forward to is grandparenthood. And so there's a really wonderful theory on aging called socio-emotional selectivity theory, which is a fancy term for talking about emotional and social connections as becoming a top priority as we get older. And so for people, for example, like your grandmother in this question, who's widowed, other family members often fill in that space. And so in the context of this study, spending time with, showing expressed love, reciprocity, those are all potential sub-facets and subsects of really kind of filling your emotional and social cup. We know that social isolation is something that we try to avoid in aging. So people love social connections, and older adults thrive in environments where they can be social. So I don't think that's limited to older adults, but when we talk about it in the aging space, having wonderful family connections, having wonderful social connections, absolutely, as long as they're positive, help bolster individuals. And so spending time with grandchildren or with other family members can often do really wonderful things for boosting mood, lessening stress, something that we know a lot of older adults find a lot of meaning in is being able to convey kind of their wiseness or their worldly wisdom to the younger generation. And that's backed by research in socio-emotional selectivity theory. But I think grandchildren can make a number of impacts. So not just in terms of the scope of my talk and my research, but also things like being able to Right. So there are the social components like spending time together, like being able to pass down wisdom. But there are also things like new learning experiences, right? We often actually heard from a number of members and care partners that grandchildren or grown children would do things like teach them how to use new pieces of technology. So there are really cool and innovative ways that family and social connections can really impact your day-to-day life. As well as other people, some older adults may struggle with driving or driving at night. And so grandchildren who are legal to drive and good and safe drivers might be a great option and another great way to integrate those social and familial connections to kind of fill your social cup up with also making people more functional and help enhancing day-to-day living in that way. So that was a really long answer to, I think, a really sweet question.
Yeah. And what we do know, what the research does show is that like being social helps with those cognitive functions, and doing things socially versus doing them alone amplifies the cognitive effects. So let's say playing card games on your phone versus playing card games with the grandkids. The cognitive effects are going to be higher and better if we add that social element in. Another thing you might think about is working out. Working out alone on a YouTube video at home is one thing, but going to a workout class or doing it in a social group, wherever your residency is or things like that, that is going to improve and amplify the benefits of whatever task that you're doing. So involve the grandkids, use them for their driving skills, make them drive you around town. No, but seriously, making your life more social, doing whatever it takes to avoid some of the isolation, especially after, 2-3 years in COVID, being able to use some of these social connections with younger people in our families is really kind of the things that we're talking about. I just saw the word depression in the chat, that can help with depression, right? That can help with some of the effects that will be amplified if we do stay home and we do stay alone and we don't make those phone calls and connect. So really, really good points there. When somebody in the chat said, "Thank you so much. I'm amazed at how much concern is being given for caregivers and partners, as well as MCI patients." That is really a tenet of the cognitive empowerment program, is that we know that memory loss is not just something that affects the person that has that symptom or that diagnosis, but it's something that affects the family system as a whole. And the people who are the closest are also the people who end up taking the most care. So taking care of the caregivers is a huge thing that we push here at Emory for people who are experiencing the effects of memory loss in their families and their partnerships, in their homes. So really noting that it's not just your loved one that is going through changes, but it's also the care partners and the family members that may need additional support, additional training, additional care, right? Additional love. Can you talk a little bit about that, Emily? Did any of that kind of come up or come through in some of the research that you were doing?
Yes, I actually did a whole caregiver burden outcome as part of my dissertation findings. So I'm really glad that you asked this question. As Megan said, the CEP in general really makes sure that there are resources, options, educations, and programming to help support care partners in this process too, and family members, whether they're spouses or otherwise. One thing I didn't touch on here, but that's absolutely relevant to this area, is the idea of transitioning to what's called an informal caregiver, right? So when I kind of mentioned earlier that not only does the person diagnosed with MCI undergo changes, and it's a transitional point for them, but care partners and spouses do as well. And so there's kind of a transition in, for example, relationship dynamics, which I think CEP does a really great job at working on programming around communication and stress management and moving your body. So all of these things that Megan also echoed. it's intentional, right? And so the idea is that transitioning to something like an informal caregiving role, because we know that folks with MCI are still absolutely functionally independent. You just may have more struggles, right? So some things that used to be easy might become a little bit more challenging. And as you work down this road, we know that not everyone converts to a dementia diagnosis. Some folks stay right where they are, and about 50% of people actually either stay where they are or revert back to a non-MCI diagnosis. So I think there's a lot of hope and a lot of really cool research that will come out on longitudinal outcomes, but it's absolutely front of mind that we are addressing the informal caregiving that's going on too for our care partners. And so the idea is that that's part of why I was so interested in mutuality, right? Whenever you observe another couple, you might notice, oh, they fight a lot, or they communicate really well, or ways that they express reciprocity for each other. And so that's part of kind of what this study is looking at, and also what the CEP is looking at and cares about. So when we talk about care partner programming, social support is absolutely essential and a huge piece of what we do here. So support groups are amazing, not just as an outlet for mental health and well-being and coping through this transitional state, through dealing with perhaps a low mood day, or a hard day, or a hard time, or a hard diagnosis. But it's also social interaction, right? So it's not uncommon for someone to face a personally or a challenging situation within the confines of a relationship, and for people to maybe isolate or take a step back. But what CEP does, and what this research is showing, is that the idea of mutuality and social connectedness and emotional connectedness can actually be a really great buffer to some of these really challenging issues that people face. So I hope I answered your question.
And then we had another observation in the chat. This is one of the things that comes up a lot at CEP too. Isadora says, lack of restful sleep and depression are two of the main issues that we are faced with. Is it possible for the MCI spouse can come off sleep medication? So I just want to comment that sleep issues, again, are something that we see a lot after a diagnosis with MCI. It's another one of those things that does not just affect the person with the diagnosis, but also the care partner and the family. And it's one of those things that we know we commented on earlier. When we get less sleep, we have less cognitive reserve. And so this idea of getting your sleep supported, adjusted, healthy, well, is something that we really amplify here at CEP. There are even tests that you can have to kind of test your sleep through the night, different sleep studies and things like that you can have done here at Emory. So there are all different kinds of support. If this is something that you are struggling with, know that you're not alone. Know that there are resources for sleep wellness at Emory through your primary care physician or your neurologist. But Emily, can you speak a little bit to some of the options and some of the things that maybe your research revealed about the specific sleep issue that is just constant and like huge, and maybe some of the recommendations that you might have for people at home who are experiencing some of the same things?
Absolutely. So first and foremost, I am not a medical doctor. So any medical advice, please talk to your provider in terms of things like getting on or off medication. But in terms of making sleep changes for getting restful sleep, and doing things like improving sleep to look at improving daily mood or depression outcomes, there are behavioral and environmental things that you can do. So for example, there are some really wonderful apps, even some that are free, that help. I think Megan would definitely be a big proponent of things like nighttime stretching, doing yoga to calm the mind down. One method for vagus nerve stimulation that helps kind of quell the body response, bring you into a much more relaxed state is called the physiological sigh. So it's an inhale with a little extra inhale at the top and then a big exhale through the nose. And so that is one of the research-backed methods that helps quite a bit. And I actually do that almost every night before bed. So that's a really easy to integrate one. You can Google it. It's called the physiological sigh if you want a better demo than I just gave. But that's really quick and easy. And then other things we talk about are limiting blue light before bed. So really working on habits and routines around what your nighttime routine looks like. One thing would be not actually getting into bed until you're feeling ready to go to bed. So for example, spending too much time in bed, some people tend to then not associate bed with sleep. So that's also an easy one. I know it's not a popular thing to say, but not watching TV or not reading right before bed, sometimes that can keep your mind awake. And then same thing with like using a phone. So that would be included under blue light. And last but not least, I think ending with the idea of getting sunlight into your eyes within the first hour of waking is really helpful for resetting your circadian rhythm. So helping your brain recognize it's morning, it's time to wake up, and doing some physical activity throughout the day. So even if that's taking something like a 2 to 3 minute walk a couple of times, spread out throughout the day, each hour would be ideal. But there's research backed behind doing things like that.
Thanks, Emily. I was just talking about some of the sleep hygiene stuff that I've implemented at my home to help with some of these things. Really simple stuff like you're saying, getting the house nice and dark and calm before bed. If you're interested in some of these things, sleep hygiene is one of the things you can kind of search for some of these terms, but do feel as though you can talk to your primary care and maybe even your occupational therapist who can really kind of help with some of this stuff too, with things that are in your home to really support your sleep. What about waking up really early and not being able to go back to sleep? Same kind of things. Are you creating the conditions in your home that are supportive of you go back to sleep, or are you getting up and turning the TV back on? Little things like taking melatonin, if it's okay with your primary care provider and doesn't interfere with any of your other medications and things like that. Small steps that make a huge impact, especially when they're all done together. And in occupational therapy, we talk about layers of support. So you may need multiple touch points and multiple layers of support for some of these things, but just know that you're not alone. The issues that everyone has brought up in this talk are common, and that Dr. Emily's research reflects that these are issues that are happening across the board. And so they're things that instead of ignoring or putting to the side or suffering with, bring these issues to your provider, be creative with finding solutions, and be willing to make small changes at home to help adapt to the big changes that may be happening in your family, in your own cognition, or in your relationships. So Emily, thank you so much for joining us, for sharing your research, for taking care of the members and care partners that you did your research with. Here at Emory, we want you to have more purpose and more meaning in your life. And after a diagnosis of mild cognitive impairment or dementia, participating in research is one of those ways that you can connect with having more meaning, more purpose, and a little bit more of a feeling of a sense of contributing to research in the future. So if you're interested in joining our programs, all of the CEP is referred through Emory Neurology. We put that phone number into the chat. We're going to post this video onto our YouTube page. You can just YouTube Brain Health Center or the Cognitive Empowerment Program and pull up all of our videos. But otherwise, Dr. Emily, thank you so much. Thanks for coming and sharing with CEP. And again, thank you for taking good care of all the people who are a part of our program too.
Absolutely. Thanks for having me. I think I'll leave you with one last nugget, which is sleep changes are not instantaneous. So be patient with yourself too. It takes time.
Really good reminders. And so do all of these lifestyle changes, right? All these lifestyle changes take time. So we encourage you to be patient with yourself, be patient with your loved one, continue accessing all this education and resources, and continue being open as you navigate the road ahead. So thank you guys so much. Thank you so much for tuning in this week. Next week, we'll be jumping back in with Iotoni. Wear your tennis shoes, wear your comfy clothes, be prepared to get active. And then on 3/14, we'll be back with Tai Chi. Thank you guys so much. Enjoy the rest of your Tuesday. Thanks, Emily.